Good morning to you all. I'm Renee Francoeur with Cabinet Communications and the moderator for today's COVID-19 update. We are joined today by Premier Sandy Silver and Dr. Catherine Elliott, the Acting Chief Medical Officer of Health. Closed captioning is provided by National Closed Captioning, and thank you to Mary Teason for providing our ASL interpretation today. Following the remarks from our speakers, we will go to the media present in the room and then on the phone lines for a round of questions. I will call you by name and you will each have 2 questions. Before we begin with our speakers, I would like to verify that everyone can hear us. If any of the reporters are having problems, please email ecoinfo@yukon.ca. I will now hand it over to Premier Sandy Silver.
Thank you very much, Renee, and thank you everybody for joining us here on the traditional territory of the Kwantlen First Nation, the Ta'an-Quachin Council. I'm pleased to be here again with Dr. Catherine Elliott. On October 15th, as you know, our government announced new measures that will be implemented to ensure our territory remains healthy, safe, and protected against the current risks that are associated with COVID-19. One important measure is a new vaccine requirement for territorial government employees, including teachers and all frontline health care workers. This requirement will also apply to employees of our partner organizations that the government funds to provide services to vulnerable populations. Since the announcement on October the 15th, we have received new recommendations from the Acting Chief Medical Officer of Health around timing between doses. Dr. Elliott is now recommending a period of 8 weeks between doses of that vaccine. And as a result, we are updating the implementation of vaccination requirements for employees. Employees will be required to have their first dose of vaccine no later than November the 30th, second dose, based upon the new recommendations, no later than January the 30th. This will ensure employees and frontline healthcare workers that have not yet been immunized have enough time to receive both doses before the new requirements come into force. Again, we continue to follow science and the advice of public health professionals. This vaccine requirement for employment will allow us to ensure a safe working environment for our employees, including our healthcare workers, while protecting the health and safety of the members of the public that we serve each and every day, especially the most vulnerable populations. We understand many employees support these measures to ensure that we have safe workplaces. We've also heard some concerns, including those from the leaders of unions as well. Minister Stryker and the Public Service Commission have been working with the Yukon Employees Union and also working with the Yukon Teachers Association to discuss the implementation of this new public health requirement. We are following the recommendations of Dr. Elliott and her team as we work through the implementation of this requirement, and our focus remains protecting the health and safety of all Yukoners. We continue to work with unions to ensure that we can provide a workspace that is healthy and safe for employees and that allows them to continue to safely serve Yukoners. The other new measures that will be implemented is a requirement that proof of vaccination will be provided to access various non-essential services and events, and to participate in certain recreational activities for those who are over 12 years old. This requirement will be based on the BC model with Yukon-specific considerations as recommended by Dr. Elliott and her team. The government officials are working with businesses, working with stakeholders as well to address concerns and to answer questions. We are in the process of finalizing the list of settings that will require proof of vaccination and will share them as soon as possible. A Yukon-specific QR code reader and an app is being developed to support local businesses and organizations to verify vaccination status. The app will securely verify an individual's proof of vaccination credential. It will be able to read any QR code that follows the Government of Canada's specifications for proof of vaccination credentials. The app does not need an internet connection to verify the QR codes, and will be made available for free in the coming weeks. Yukoners can already request their proof of vaccination credentials online, and that's at yukon.ca/vaccine-proof. You can also access this service over the phone via the COVID-19 info line. That number is 1-877-374-0425. This line is open 7 days a week from 7:30 a.m. till 8 p.m. I know there's been a lot of questions since we announced the new measures last month. There's a lot of additional logistical details to work out in the coming weeks, and we understand that there will be challenges ahead. These new requirements are based upon the recommendations of the Chief Medical Officer of Health to protect Yukoners. These measures also align with steps being taken in other jurisdictions right across the country to increase vaccination rates and to combat the Delta variant. We have also seen businesses and other organizations introduce similar policies in recent weeks, and that is very good to see. We need to work together to do everything we can to stop the spread of COVID-19 and to keep Yukoners safe. I also want to be very clear that the choice still belongs to individuals, whether or not they want to receive the vaccination. We need to keep in mind, however, that our choices do have consequences and that our individual actions have an impact on the health of our entire territory. We strongly encourage everyone to get vaccinated, as we have ever since the vaccinations have become available. Vaccination remains the best protection against COVID-19 and the spread of the disease. It also reduces the chances of severe symptoms, including death, if you do get infected. Now, we all have a role to play in keeping our territory safe and healthy, and we need to be kind and helpful to each other because we are in this together. I encourage all Yukoners to continue to practice the Safe 6 and to continue to wear a mask, the +1, if you're inside. These measures absolutely help to prevent the spread of COVID-19. It is especially important to stay home if you're sick and to get tested. Our government introduced a paid sick leave rebate program at the outset of the pandemic, and it is still available to employers and self-employed individuals as well. And you can find the details about that program on yukon.ca. We all need to take action to increase vaccination rates to keep Yukoners healthy and safe. The vaccine clinics here in Whitehorse is open 5 days a week. Vaccines are also available in all Yukon communities at your local health center. You can find information about the vaccines and how to get your shot by going online to yukon.ca/thisisOurShot. Again, the vaccines are safe and effective, and they save lives. Increasing our vaccination rate will also lead us out of the pandemic and move us towards that path of recovery and back to a new sense of normal. Thank you, everybody. Dr. Elliott.
Thank you, Premier Silver. Good morning, everyone. Bonjour à tous. I'd like to begin by acknowledging that I'm on the traditional territory of the Kwalin Dun First Nation and the Ta'an Kwachun Council. I'll start with an update on COVID-19 activity in the Yukon. As of 9 a.m. this morning, we have 77 active cases in Yukon. There have been a total of 973 cases, and 889 people have recovered from COVID-19 in Yukon. We've had 10 Yukoners die from COVID-19 since the beginning of the pandemic. Our current 7-day running average of new cases, daily new cases, is 10.1. The 7-day average of active cases is 72. Percent positivity at this point is 7.1%, meaning 7.1% of all tests conducted in Yukon are positive. There are currently 2 people in hospital in Yukon with COVID-19. We are seeing an increase in case activity. From October 1st to 29th, we had 182 new cases in Yukon. This represents an approximately 125% increase from the number of cases in September. Approximately 85% of these cases were individuals under 50 years of age. We are seeing cases amongst people who are fully vaccinated. 49.5% of our cases during that period were unvaccinated. 4.4% were partially vaccinated, and 45.6% of these cases were fully vaccinated. This means that we've had approximately half of our cases in the 74% of the population that is fully vaccinated, and half of our cases from only 16% of the population that is not fully vaccinated. This is why we know, and how we know, that vaccine continues to protect us from infection, severe illness, and death. Since October 1st, we've had 4 hospitalizations, including 1 medevac to the Southern Hospital. This person who was medevaced was not fully vaccinated. I want to first congratulate the 146 people who have taken their first dose of vaccine in the last week of October. Thank you from myself and for all of us working to prevent the spread of COVID and to keep people safe and healthy. I also want to reiterate that vaccine is our way through this pandemic. Evidence is clear that fully vaccinated individuals diagnosed with COVID-19 are significantly protected from severe outcomes. I'm going to give you some numbers, national numbers, for those people who love numbers as much as I do. As an example, evidence was submitted to the Public Health Agency of Canada from December 14th, 2020 to October 9th, 2021. From all provinces and territories in Canada, what was found was that 815,473 people, or about 815,000 people in Canada, were diagnosed with COVID-19 during that time. Out of those people, 48,502 people were fully vaccinated. Of those vaccinated, 2,035 were hospitalized, and 608 of those people died. Vaccine works. It's not 100% foolproof. That's what we can tell with that. So let's go back to those people who were unvaccinated. Of those 815,473 people, 676,866 people were unvaccinated. Of those unvaccinated, we saw 36,579 people hospitalized. 7,264 of those people died. If you're eligible for vaccine, please get vaccinated. In Yukon, 85% of residents over age of 12 are fully vaccinated. This is a very high vaccination rate and a wonderful accomplishment for our immunizers and programs, our IT teams, labs, and everybody who supports this program. It's also comparable now to many places across the country. We continue to lead the country in terms of the rate of our vaccinations early in the pandemic, and we're still within the top group in this regard. But I know that we can do better. Cases are occurring in fully vaccinated people, and these people can transmit to others. The more people who are vaccinated, the fewer people will get COVID, and the fewer people will get sick, very sick. Every preventative measure we can take, we should take. Remember that vaccine appointments are available on yukon.ca, in Whitehorse, and in all the communities. Last week, we announced that boosters are being rolled out across the territory this week for 50 years and older. We expect to be able to offer boosters to everyone who needs one in the coming months. We've started conversations with communities and groups around the booster shot. I was so pleased to see that in the first week of appointments that they booked up very quickly, and thank you. More appointments will be added regularly. Every person over 50 who would like a booster will receive one. And I want to recognize everyone who's working on operationalizing these clinics and all of their incredible work. Let's talk a bit about children. I know a lot of people are concerned about children in their families, their communities, and their own children. In the month of October, I issued 10 school exposure notifications, and we also called the end of an outbreak in Carcross Community School. As I said earlier in October, we can expect to see more outbreaks in schools as we move further into fall and into the winter months. Elementary school children are not eligible at this time to be vaccinated. And as any parent can tell you, one case of cold can impact the entire class. We're also seeing a lot of other respiratory illnesses in children. And I thank all the parents and children who have been tested to determine whether their sniffle or their fever or their chills is COVID or is something else. Fortunately, children are also less likely to become really sick. And even with the Delta variant, this is in part why we have a low severity of cases at this time, meaning that for the number of cases that we have, very few people actually have been hospitalized or passed away. Even with the Delta variant, we're seeing that children are less likely to be very sick. We continue to work with the Department of Education. We're able to ensure the proper steps are taken to protect students, teachers, and other staff members. One thing that we have not seen is a lot of transmission from one class to another class. And this speaks to the efforts of all of the members of the school community who are working hard to ensure that the measures in schools are followed. Children are continuing to do a lot of things that keep them safe and healthy, not just go to school, but engage in the arts, in music, in sports, and in other activities. And this is a wonderful thing that we can do at this time. While we're continuing to see an increase in school exposure notices, we know that having kids in school is better for their mental health and well-being, as well as for their learning. On Friday, the U.S. Food and Drug Administration authorized the emergency use of the Pfizer-BioNTech COVID-19 vaccine for the prevention of COVID-19 to include children 5 to 11 years old. Many people are asking when we might see the vaccine here in Canada. Right now, it's going through the regulatory process with Health Canada, and this does take time. The reason is because we are very careful with vaccines. They require a fair bit of testing, a lot of studies to look at whether there are potential side effects, to look at whether they're effective. We offer vaccines when they're effective and safe. Once this has gone through, the vaccine has gone through the regulatory process with Health Canada, and we have the guidance of NACI, we will be ready, and we are ready, to deliver those childhood vaccines. I do want to say that children are eligible for influenza vaccine, and I encourage parents to have their children vaccinated and children to be brave enough to get vaccinated. I know many children are afraid of needles. Some are close to my heart, and I've seen a lot of bravery amongst our children in their vaccinations. The vaccine mandate. Lastly, I'll speak to this. As the Premier discussed, the vaccine mandate here in Yukon will be adjusted to reflect the National Advisory Committee on Immunization's updated recommendations around the interval between dose 1 and dose 2. People might find it strange that at first the recommended interval was about 4 weeks, and now we're moving to 8 weeks, and they might wonder why. Those who are actively reading the information about this will recall that in the early days, when many of the provinces didn't have enough vaccine to offer 2 doses to their entire populations, they offered 1 dose first to everybody before moving into the second dose of their program. One of the things that we've learned from this and other programs, similar programs, is that people who have been vaccinated with that longer interval develop over the longer term, a stronger and more lasting, more durable protection. And that's why NACI's moved to say the recommended interval is 8 weeks. They offer a number of different options for intervals, and certainly 4 weeks is still within the options available. However, it doesn't offer that same long-lasting protection. Here in Yukon, our program had a shorter interval, which meant that we had our population protected with 2 doses, as many people who were willing to come and get vaccinated very quickly, and that served us well. At this time, as we offer vaccines to those people who haven't yet become vaccinated, we want to offer it over that 8-week interval to ensure that people get that longer lasting or that duration of protection. Of course, this also offers people to become educated, to have the time to have the questions and conversations that will help them understand the importance of the vaccine. I also want to let you know that a part of this vaccine mandate is because we don't want to reach a situation of healthcare system overwhelm. Every day, our healthcare system staff and those people who support them are working hard and are being tested. The teams are tired. I know we're all tired of this pandemic, but we have to continue to do everything we can to protect our healthcare system from being strained. We've seen this happen in other jurisdictions in Canada, and we can't afford to have it happen here in Yukon. And that's why we need everybody to come out and get their shot. Let's also remember that getting your flu shot, wearing a mask, washing your hands, staying home and away from others when you're sick, and getting tested when you have symptoms are all important. Please keep with your close bubble and social gatherings, please keep them small. Getting vaccinated is important, and we have enough vaccine for everyone, and every person who gets vaccinated helps. I know we're tired, and also I know many people, many among us love the winter months, love the fall, the cold air and the crisp air, love picking cranberries or watching the frost in the early morning. Some love skiing, others hunting, northern lights are out, and others like to stay cozy inside by the firelight with warm food and familiar faces. These are all things that we can continue to enjoy at this time. We're all preparing for winter, and I urge you to take care of yourself and make the vaccine part of your preparations. Please stay connected with each other. This is how we stay healthy, and continue to support one another, even the people who have opinions that are different from our own. Be kind and considerate. Thank you, Shonitan, Gunonshich, Masicho. Merci. And now we can take questions.
Thank you, Premier Silver and Dr. Elliott. We'll now move on to the question and answer session with media. A reminder to reporters, please identify which speaker you would like to answer your question before you start. And please also remember to mute and unmute yourselves. We will first go to the reporter in the room and start with Jackie from CBC.
Good morning. I think my first question is for the Premier. I know it's just in regards to the vaccine mandate, and you mentioned the advice from the acting CMOH. I'm wondering if concerns from the unions and the 2,000 more Yukoners that signed that petition earlier this week influenced the decision to push the timeline for the vaccine mandate at all. Obviously, you're following medical advice, but
We are. Yeah.
was that also a factor?
No, again, we're for the last 20 months, our movements are based upon the recommendations from the Chief Medical Officer of Health. That isn't changing now. Dr. Elliott has provided us with new recommendations around the vaccine delivery, and we're following those recommendations, which are clearly coming from NACI and their most recent publications. As far as any, you also mentioned unions as well. The Minister Stryker is he had a commitment made to the unions that was to consult with the acting Chief Medical Officer of Health on the proposed any proposed alternatives. As far as we do understand that there are going to be some people that have medical conditions that wouldn't that'd be eligible for a vaccination, but cannot do so for some medical reasons. So we still have to consider that. We're obviously taking that into consideration as we implement the requirement. But no, we will continue to make the policies that are based upon the recommendations, and this will be a requirement for government employees.
Thank you. Do you have another question, Jackie?
I do. I'm just wondering if at this point you're able to offer any clarity about what happens to people who don't have, I guess, the first shot now by November 30th and are not fully vaccinated by January 30th, whether by choice or by medical exemption.
Yeah, so we're still looking at that. My cabinet is meeting to discuss several policy details this week, and we will be sharing information as it becomes more available.
Thank you. We'll now move to John on the phone lines with CKRW.
Hi, my first question is for the Acting Chief Medical Officer of Health, Dr. Catherine Elliott. We've seen the good that mask mandates can do to help prevent the spread alongside the vaccine mandate. And as previously noted by other journalists, there are a lot of people in the territory that don't want to get the vaccine, even if they have the information about the vaccine. They're just starchly against it. So will mask mandates or some sort of masking guideline where people are required to wear their masks indoors be coming back as a way of trying to find some sort of middle ground?
Thanks for the question. Masks are an important part of our protection against COVID-19 for people who are vaccinated and for people who are not vaccinated. Wearing a mask in indoor public spaces has been shown to reduce the transmission by as much as 60 to 80%. As I've said, people who are unvaccinated and people who are vaccinated are getting COVID-19 at this time. Those who are unvaccinated are much more likely to get infected and even more likely to be hospitalized or to die. Mask mandates are one tool that can be used to promote the wearing of masks. I've been very clear in my recommendation that masks should be worn in all indoor public spaces, and I've seen many, many people take on that recommendation. In fact, I see few people who are not wearing masks at this time. We need to watch the science, watch the epidemiology, and see whether this is sufficient to help to bend the curve with mask wearing. Mask wearing is not something that's just for people who are unvaccinated or just for people who are vaccinated, and it's not the only layer of protection. We need the full spectrum of the layers of protection that we have, the safe 6+1, the one being the mask, and the other measures such as the measures that we're using in schools, in workplaces, in businesses, etc. All of these together protect us. There's not one foolproof bullet that works for everything and every situation, and masks are part of that picture. Thanks.
Thank you. John, do you have a follow-up question?
I do. I'm not sure if this was asked already, and this question is directed towards the Premier. What's going to happen to workers that decide they're not going to get the vaccine and then the mandate comes into effect? Are they going to be put on unpaid leave, or are they going to be terminated outright? What's the government's plan?
Yeah, so the question was asked already, and again, we're looking into, the deadlines of proof. We're working with the unions right now. More will be communicated in the coming days and weeks, but we also talked about the deadlines that are there for first and second dose.
Thank you. We'll now move to Haley at Yukon News.
Thank you. I had a follow-up question for the Premier, again, on that question of what happens to people if they do refuse the vaccines. I mean, if details are released that next week, that gives people about 2 weeks to figure out their livelihood if leave without pay is on the table. Could you explain the rationale a little for what's taking so long to make those decisions about what happens to those folks who just aren't going to get the vaccine?
So again, what people need to know is, there is a requirement for vaccines. They also need to know that in order to get vaccinated in the time necessary with the new recommendations, that the deadlines are looming, and that's been made public now 2 weeks ago and then this week. Whether or not the second vaccine is 4 weeks or 8 weeks, it doesn't change when you should be getting your first dose, and so that requirement is within the end of this month. We've also spoken how we're going to follow the advice of the Chief Medical Officer of Health. We don't see a situation other than a medical situation where an alternative to vaccination is going to happen. And we also know that would affect a very, very small portion of our population. So as we work out the details, I know the Public Service Commission, the unions have been speaking, and also with the Chief Medical Officer of Health. Our recommendations are still going to be based upon science. Our recommendations are still going to be followed by this government. The logistics about how and the results at the end, if folks choose not to, we will be announcing more details as they get worked out. But lots of conversations have been had since the first announcement, and we will update the population. We'll update Yukoners as soon as we possibly can with any of the details. But again, folks, the writing is there. The recommendations are solid. The rationale is solid. We're moving in this direction. And unless you have one of those identified, I guess the one identified medical condition, then that's a consideration. But otherwise, you have until the end of the month for your first vaccination. And then again, announce the deadlines for the second with the 8-week notification from NACI and the recommendations from Dr. Elliott.
Thank you. Haley, do you have a second question?
I do. Yeah, thanks. I guess, my second question would be in that case, what details still need to be worked out? Because that makes it sound as if, unless you have a medical exemption, that there won't be workarounds that involve continuing to be paid by the government. Is that the case? Will there be any workarounds around testing or remote work, or will you be requiring to get the vaccine to get paid?
I can't foresee us going into any different direction. I mean, we can't predict the future. Lots can happen from now until the end of the year. But again, we've made it very clear as well. A lot of our recommendations have been based upon the BC model. Folks have seen the situation play out there weeks ahead of us as well. There's a few Yukon-specific considerations that we can't just copy and paste, obviously, for lots of logistical reasons, but also lots of epidemiological reasons as well. So, but also knowing, Yukon-specific considerations, those are the fine details that have to get worked out. But, the majority of the situation has been already identified, and again, the requirement will be to be vaccinated.
Thanks, Dr. Elliott.
I know, thank you, Premier Silver. And Premier Silver speaks to the science, and I'd just like to lay out a bit of the science that we have right now. Many people may have believed, because we had such little COVID activity in the first bit of the pandemic for many months, and because we survived that way with a number of measures in place, that they can continue to have those measures in their personal lives and protect themselves from COVID. This is not the case. If you're unvaccinated and you're going about regular activities, including working, you'll get COVID eventually. This disease is not going away, and you will not be able to keep it off at bay with this measure and that measure. That's a part of the science that we're looking at this point. Listen, even vaccinated people are getting COVID. They're not getting severely ill, but those of people who are unvaccinated are at very increased risk of being hospitalized and dying. We have the Delta variant right now. I'm sure there are other variants around the corner. So this is going to be going on for a long time. Backing down from vaccination now is not going to solve the issue of the risk of getting COVID. And I think we really just need to accept that as a part of our new reality in living with COVID. Thank you.
Thank you. We'll now move to Tim with the White Horse Star.
Thank you. Can you hear me?
We can. Thank you, Tim.
Okay. My first question is more of a question of clarification, probably more for the Premier. So with the deadline being backed off to January 30th for public servants to get their second vaccinations in, is that deadline also shifted for non-essential things, having to prove that you're vaccinated, say to go into a bar or something? Is that pushed back to January 30th as well, or is that still firm on November 30th?
Yeah, so again, our new recommendations coming in are based upon the 8-week interval between so that affects everybody. And so, again, our announcement today is, extending that time in between the two will affect all of our policies. But again, it doesn't affect that first vaccination. I think that's the salient point right now. Even if there's going to be a gap between the first and second, you still need to get the first one in a timely fashion.
Do you have a follow-up question, Tim?
I do. And this would be regard to, or for Dr. Elliott, in regard to moving from the 4 to the 8 weeks now. That original 4-week period in between vaccines was the science up to that point. Does it look, with hindsight being perfect, that maybe wasn't the best idea for the territory as a whole now?
I think the 4-week interval, which many people in Yukon had, was the right choice. Was the right choice at that time. And the reason is we were just starting our vaccine campaign. Unlike the rest of Canada, we were prioritized for vaccine. And because of this, we were able to offer 2 doses to people very rapidly. We rapidly increased our vaccination rate. And when we were hit with COVID periodically during those times, and most notably in June, our vaccination rates were very high. And we definitely suffered during those periods, but we would have suffered much more had we not had those 2 doses available and in as many as our population as we had. At this time, with the new knowledge and the new science, this is the time, and with 85% of our eligible population vaccinated, this is the time now to take that 8-week interval as well. We're also offering booster shots for people who are 50 and older, which will assist those people who have a bit of declining immunity, and particularly those who are at risk of severe illness, the much older people, from having those outcomes of COVID. This is COVID-19. It's the new reality. We said we would have a vaccine hopefully within 18 months, and we had it within 12 months. We said we would have, maybe the vaccine would be produced at a certain rate. It was produced faster. This has been an unprecedented time of scientific achievement and of public health response. And I think, it's something that is remarkable to see. And yes, the science changes, the decisions will change, COVID-19 changes, and we all struggle to keep up and keep along and realize how fortunate we are to have such a rapidly moving scientific field to support our public health measures. Thank you.
Thank you. We'll now move to Marianne at l'Aurore Boreale.
Oui, bonjour. J'aimerais avoir la réponse, s'il vous plaît, à la question sur les conséquences qui seront données pour les employés qui ne sont pas vaccinés, en français, s'il vous plaît.
So, would it be possible to repeat in French what the consequences will be for the government of Yukon employees that will not be vaccinated in time?
If you say it in English, I can say it in English.
Yeah, sure. So again, deadline of proof of vaccination, will that change? It's an area we're working on. Cabinet is meeting to discuss several different policy details this week, and we will share more information as that becomes available. I think the big question about whether there's an alternative to vaccinations, basically, and whether testing is going to be the alternative. At this time, the recommendation from the Chief Medical Officer of Health is no. I think that's the salient point for today.
Okay. Merci. Je vais essayer de traduire les mots du Premier Silver. Il a dit que le date de preuve de vaccination reste le même et que les détails du policy vont arriver plus tard cette semaine. Et aussi que ceux qui se demandent qu'est-ce qui est l'alternative de vaccination obligatoire pour les travailleurs, les discussions sont maintenant ils sont en discussion avec les unions et avoir un test, ce n'est pas une alternative du mandat de vaccination. Et moi aussi, j'ai dit au sujet de science que ceux qui pensent que n'avoir pas une vaccination et se vivre au Yukon comme ça et ne deviendra pas infecté avec le COVID-19, c'est pas la réalité. La réalité, c'est qu'on vit maintenant avec le COVID-19. Ceux qui sont vaccinés, qui arrivent à être infectés, sont protégés. C'est une maladie tout à fait différente et le risque de avoir besoin de l'hôpital ou bien de mourir, c'est vraiment beaucoup plus bas que ceux qui sont pas vaccinés. Ceux qui sont vaccinés, pas vaccinés, c'est une maladie qui a la possibilité d'arriver à l'hôpital ou bien mourir beaucoup plus tôt que les autres. Et c'est pour cette raison qu'on veut que tout le monde prenne le choix d'être vacciné. Merci.
Thank you. Marianne, do you have a second question?
Oui, merci. Comment vont être gouvernementaux qui devront mettre en place les mêmes mesures que le gouvernement?
Marine, pourrais-tu répéter la question? Ça a coupé.
Pardon. Est-ce que vous pouvez nous donner plus de détails sur quels seront les organismes non gouvernementaux qui devront appliquer les mêmes mesures que le gouvernement?
So could you tell us which other organizations that are not the government who will have to apply the same requirements in terms of vaccination?
Yeah, so again, as we look at the BC model, there are some Yukon-specific considerations that might not apply in BC, and so the details of who is and isn't on those lists will be made available very soon.
Thank you. We'll now move to Vincent at Radio-Canada.
Oui, bonjour. Dr Elliott, est-ce que vous pouvez détailler la différence en fait entre les vaccinations pour les personnes qui ont été vaccinées 4 semaines après la première dose et 8 semaines, juste pour peut-être dans le détail sur l'efficacité du vaccin, et juste aussi du coup pour les personnes qui se sont fait vacciner 4 semaines après, est-ce que vous allez recommander la généralisation d'une dose de rappel? Merci.
So, Dr. Elliott, could you please repeat what differences it makes for those who have been vaccinated with the second dose 4 weeks after the first, and those that are being vaccinated 8 weeks later? What kind of difference does it make? And should people be more concerned with booster dose if they have been vaccinated 4 weeks instead of 8?
Merci pour la question. Il y a, au début du programme de vaccination, on a donné les gens le vaccin un jour, puis 4 semaines plus tard, l'autre dose. Et ça, c'était la recommandation de NACI à ce temps-là. Et c'est encore possible d'avoir les vaccins comme ça. C'est vraiment... il n'y a pas de risque de... safety avec ça, mais on a trouvé il y a beaucoup de provinces qui n'avaient pas assez de vaccins, d'avoir donné tout le monde les 2 vaccins. Ils ont alors choisi d'avoir la première dose et puis quand ils avaient assez de vaccins, de donner la deuxième dose. Et ce que NACI a trouvé, c'est que si on prend les 2 doses avec un intervalle de 4 semaines ou bien 8 semaines, ceux qui ont l'intervalle de 8 semaines, ils ont la protection qui est plus durable avec le temps. Et c'est pour ça qu'on maintenant on recommande l'intervalle avec ceux qui ont se prend les doses maintenant, d'avoir les 8 semaines. On a la question aussi, c'était est-ce que les gens qui ont pris leur dose avec 4 semaines, est-ce qu'ils ont besoin d'une autre dose, un booster pour avoir assez de duration de protection? Le science des boosters, c'est quelque chose qui, comme toutes les sciences de COVID, mais vraiment maintenant, on étudie la science de troisième ou booster dose des vaccins. Ce qu'on a trouvé, c'est que les gens qui ont les 2 doses et puis ils ont 6 mois après la deuxième dose, les gens qui sont plus vieux ont un peu de décrément dans leur protection pendant ce temps-là. Et c'est pour ça qu'on offre les booster doses maintenant pour les gens qui sont 50 ans et plus. La science maintenant pour les gens qui sont moins de 50 ans, c'est pas ce qu'on sait maintenant, c'est qu'on a une bonne protection et qui dure encore. Mais on va trouver beaucoup d'autres choses au sujet de cette booster dose dans les semaines et les mois qui passent parce que le booster, c'est une science nouvelle pour le vaccin de COVID-19. Bien sûr, on connaît bien qu'il y a beaucoup de vaccins que les gens ont besoin des autres doses quelques mois ou bien quelques ans après, comme si vous avez des enfants ou bien vous connaissez les enfants qui ont les doses parfois dans leur jeunesse. C'est comme ça. Mais au sujet de longévité de protection avec le vaccin de COVID-19, on va trouver encore des nouvelles choses. Et c'est pour ça qu'on commence avec les plus vieux. Merci.
Thank you. Vincent, do you have another question?
Oui, merci. Une question pour Monsieur le Premier ministre. C'est la réouverture de la frontière avec l'Alaska bientôt pour les Yukonais. Je voulais savoir si, pour beaucoup d'entre eux, le fait de devoir avoir un test qui coûte environ $300 ou un peu moins, ça reste un frein et donc une fausse réouverture. Est-ce qu'il y a toujours des discussions en cours avec l'Alaska pour peut-être faciliter ces passages de frontières? Merci.
So the question is for the Premier. With the border with Alaska reopening and people wanting to travel from one to another, it's been seen that having a test that might cost $300 might be a break into going there or refrain from going to Alaska and vice versa. Is there still discussions about this test and how it could be facilitated, maybe cost less for Yukoners?
Yeah, it's an excellent question, and it's something that's been brought up on the Council of Federation and the First Ministers' meetings, conversations as well, and we'll actively work with the federal government, bringing that information forward. I completely agree. You know, as we're getting back to normal, as people that receive those vaccinations now can travel, and the conversations that I've had with Governor Dunleavy or the mayors in the hamlets of Skagway or Haines, we really do want to get back to some resemblance of normal when it comes to the economy, but when it also just comes to seeing our friends in Alaska. So the cost of these tests is going to absolutely be a deterrent to a lot of people, and so we're going to continue those conversations with the federal government, to whom's requirements and policies we're talking.
Thank you. We'll now move to Camille with Canadian Press. Hello, Camille. All right. We'll come back to you at the end, Camille. One more reporter on my list, Laurie at L'Aurore Boreal.
No question, thank you.
And we'll try one final time. Camille at Canadian Press. All right. Thank you, everyone. That concludes our COVID-19 update for today. Our next COVID-19 update will be next week. Thank you again to Premier Silver and Dr. Elliott. Thank you also to all the media and everyone who tuned in to watch live over Facebook, as well as thank you to Andre for our French translation. I forgot you in my intro. Thank you. Have a wonderful Wednesday, everyone.